So let's talk about a not so fun topic but extremely important: complications on hair transplantation surgery when hair transplants go wrong. Very important topic. Don't miss the video. You're gonna like it and you're gonna need to know things about it. Welcome back to the channel. Hope you're doing great today. So I have a topic for today that's, kind of a little hard to talk about, but extremely important. I've been lecturing to doctors and to patients and to other professionals for many, many years in big conferences. And one of the topics that we are always eager to learn for whichever procedure is complications. Again, nobody likes to deal with complications. I'm sure you wouldn't like if it happened to you. I don't like it when it happens to me too. But as surgeons, we are exposed to complications all the time. Every time that there's a procedure, every time that you plan something, there's a chance that things may not go right. Fortunately, hair transplant surgery is very safe. It's a very predictable procedure. Even the worst complications are not really life-threatening for the most part. However, there's been cases reported, luckily not with me, thank God, that patients that actually had heart attacks during a hair transplant procedure because of the medications were given incorrectly, the patient wasn't pre-oped correctly, or things like that. There's even a couple of patients that died after having a hair transplant procedure. But for the most part, complications can be treated. They can be prevented, which is what we're going to talk about here. But you have to have someone, the surgeon, the doctor that's going to take care of you, needs to know about this and start planning from the very first time that you meet with him or with her. So we're going to talk about some of the ones here, and then at the end I'll go into a little bit of a topic on FUEs and the potential complications and what we're seeing now, a phenomenon that's been happening over the last few years on FUE complications. So let's go ahead and start. Definition of a complication, it's basically, for the medical term, in the medical field, is basically a disease that aggravates an existing disease. So let's say you went in for an elective, say, hernia surgery, and everything was supposed to go great, but then you had an infection on the incision and it didn't heal properly, or the mesh from the hernia didn't heal properly, and you had to have another procedure to do it. So basically, that's what a complication is. It's either an unforeseen, or for the most part, most of the time, it is a well-known potential risk of the procedure, and that aggravates the original condition. How common are complications in hair restoration surgery? As I mentioned before, fortunately, they're very rare. The bad complications are even rarer, so we hardly see them. Although I've been president of the American Board of Hair Restoration Surgery before, a few years ago in 2017. I've been an examiner for them to test the doctors to get their board certification. And every year we do what we call Morbidity and Mortality Conference. This is something that a lot of hospitals do in their surgery departments. And so surgeons will get together, and within a private environment, non-judgmental, they will present cases that have complicated, or patients that had outcomes that were not ideal. And the idea for that is not to judge or to criticize the doctor or the surgeon, but also to learn, right? To learn from the problems and to learn from the complications. So there's a saying, I don't remember who says it, but there's a phrase that says something like this. I may quote it incorrectly, but the gist of it is, learn from the mistakes of others, because you can't leave enough to make them all yourself, right? So as a surgeon, we have to learn about complications. We have to learn from other people's mistakes, from our own mistakes as well. Nobody's perfect. And there's another saying that says, if a surgeon ever tells you that he or she has no complications, either he or she is lying or they're just not operating, because if you do enough surgery, you're going to have complications. So with that said, let's kind of jump in and see the most common ones and what can be done about them. So as I teach complications around the world, I usually use this little kind of formula. It's an easy thing to decorate or to memorize for doctors, right? And so, but it translates to you as well as a patient. So what that means is the more knowledge and the more experience your provider, your surgeon has in the subject that, in this case, hair loss and hair transplant surgery, the more knowledge, the more experience they have, the more likely they are to have increased or heightened patient selection and prevention of complications. So what does that mean? The more experience I get, the more surgeries I do, the more I see, the more I learn, the more patients are turned away. And that sounds like a kind of a funny thing, but it happens all the time. And when I was training in my early days of general surgery, much younger than now, and we were eager to operate on everybody. One of my mentors, one of my professors told me, as you get older, you're going to do less and less procedures because you're going to be much more selective. And hair transplant surgery is not an emergency surgery, so we have the luxury of telling someone, I'm not going to operate on you, you're not a good candidate, your potential for complications is too great, so I'm not going to do it for you. So we have that luxury. If I was a trauma surgeon working in the emergency room and a car accident victim came in, I have to save their life. I don't have any choice, so I have to deal with the problems. But for us here, there's no excuses. Hair transplant surgery should be done in the safest way possible, and the more knowledge and experience that I get, the more I value these things and the more I turn patients away. So what do good surgeons do about complications when they occur? And they will, right? So first of all, they plan and they prepare to avoid them. Again, planning the surgery, recommending the right type of surgery, preparing you for what may happen. That's all part of the preparation and prevention. If you have a health issue, say diabetes, that puts you at more risk for complications, for healing and for infection, you need to control your diabetes before we do the surgery. So again, we have time to go to look for all these problems before we put you through it. So all these parameters, if you chip away the problems, the potential problems, you're going to make a surgery much safer. So it's all about prevention, and a good surgeon will do that for you. A good surgeon will also diagnose a complication early. There has been multiple cases where physicians delayed the diagnosis of a complication, and then there was some problems for the patient, sometimes long-term problems. So anyway, a good surgeon will not delay the diagnosis. It will start intervening sooner and very effectively. That's why all of my patients have my cell phone number. I tell them all the time, if you have a problem, no matter how small, if you have a question, I want to know right away. That way we can prevent it from getting worse if it starts to go like a complication, and also we can treat you early. Also, surgeons are humble. That's not, a lot of times that doesn't go away. That doesn't go with surgeons a lot of times. Some of us are not the most humble people, but we should be. Again, it's all about relationship between you and me, and you and your provider. So there should be trust. There should be communication, effective communication between the two of us, so that we can be on the same page and get you treated and get you to the finish line. If I'm not humble and I just try to diffuse the situation or blame you or whatever, it's not going to help anybody, right? We're still going to have the problem to deal with. And also, surgeons that are good, they know how to treat the complications. So in hair transplant surgery, we have some complications that are more common, even though they're rare. If I were doing liposuction, I would have to understand the complications for liposuction and so on and so forth. So every procedure has its set of particular complications that can happen. A surgeon that's really well experienced and has the knowledge, again, the formula that we talked about, he or she will know to treat the complications as they occur if they do. And if they are not able to do it, if there's a complication that there's outside of their area of expertise, they will refer you to someone. For example, I mentioned that there has been some cases reported of patients that had a heart attack during the hair transplant procedure. Didn't happen to me, thank God, but if it did, I'm not a cardiologist. I mean, I know how to provide first aid and get the patient stabilized until an ambulance can take them to a hospital, but I have to refer them to a cardiologist, obviously, and so that illustrates the point. So a good doctor will never shy away from doing the best for you. So again, going back to how to prevent complications, it all starts in that first meeting, either virtual nowadays with the COVID, we're doing a lot more virtual appointments, or in person. It doesn't matter. There's a video about consultations that you can watch. I'm going to put the link right here for you to watch it. I go through every aspect of the consultation and why it's important for a doctor to cover all that stuff with you. And that will end up preventing problems, preventing unknown factors from getting into the equation and complicate your procedure. So the planning, the goals, everything has to be discussed in length in your consultation before anything is done to you, before a procedure, if anything is recommended. So it starts right there. If you don't have a person or a doctor that will give you the time of day to even see you for the consultation, if they send somebody like a salesperson or a consultant and you never see the doctor, I mean, this is still a procedure. It's not child's play, So if you don't see a doctor for your consultation, big red flag, and you should run away from those places. And there's still people that do that. So again, a surgeon or a doctor needs to be diagnosing you. Not every hair loss requires a transplant, or actually should be treated with a transplant. So you deserve to have someone that knows this, or at least a doctor seeing you. Also planning, right? So this is a case of mine, and I'm known for being very graphic with my markings in the surgery. That comes from my background in general surgery and also in other cosmetic procedures in the past, back in the day. For the last 22 years, I've been doing just hair, but before I did a lot of other procedures. And my mind works a certain way that if I have all these lines here, not only I know that you understand, that I understand what our goal is. This is all done after you and I had a chance to discuss things and the plan and review the plan before the procedure is even started, before I give you any sedation or any drugs. And so the markings, if you look at that, you say, okay, well, he knows what he's doing and he's going to execute that plan. For me, as I'm there, in this case, it's an FUE procedure. You can see here, hopefully, that there's the word no here. So I marked that because it's an area that's not permanent donor zone. So I put that up there because I don't want to harvest any hairs from here. Well, if I'm working with my loops, very, very powerful loops to see the hairs really well, it's easy to lose track of where you are in the scalp. So as I approach these lines and I see them, I'll take a look and I'll kind of look from the distance and see where I am. So these lines are for my orientation. They may look funny or anything like that, but they're there for a reason. Same thing here, marking the hairline shape, the hairline position, where I'm gonna go and blend the area. So even the hair direction here, where the patient had the whirl there. So these are all visual cues for me. You're going to be sleeping. You're going to be relaxing. You're not going to have to worry about any of these things, and that's not your job. It's my job to translate the plan that we have in our minds into a plan like this that I know, and then from my mind to my hands to your head to the result. So that's what we should do, and that's why I do it this way, and I teach everybody that I train on this procedure to mark, because it'll save you a lot of grief in the future. I've had patients that came to me after having surgery by somebody else and said, well, he or she didn't put the hairs where we discussed that we were going to put it. Why? Because they didn't mark it and they forgot, and so the patient wanted to say the hairline and they put the hairs back here. It's happened before. So that's why I use this marking. Another very important part of prevention of complication is doing a safe procedure, right? Not just because we're in a COVID pandemic right now and everybody's wearing masks, everybody's worried about that now. Of course, we've always been concerned. Because of my training in surgery, I've always did procedures here, taking safety to the nth degree. So if you look online, if you go on Google and you look at different hair transplant practices out there and you look at pictures, you will see very easily surgeons, hopefully, sometimes not even surgeons, technicians, wearing gloves but no gowns, wearing goggles. Sometimes the mask is hanging out and not covering their full face. They don't have anything on their hair to keep it away from the surgery. Well, you're still making incisions. Yeah, they're superficial, but there's potential for infection, Plus, the personal protective equipment that we use, the gowns, the goggles, the loops, the masks, the hair cover, even the shoe covers too. They are not just for your protection, they're for us as well. And so it's the least that we can do, right? Provide a safe environment for you. When surgeries start here, we wash your hair with a surgical soap to sterilize the scalp and clean. Unfortunately, I don't see a lot of people doing that. And infections are rare in hair transplant surgery. I'll give you that. But if you cut enough corners, you're going to end up having trouble. With the advent of the COVID, we actually exponentially increased our sterilization technique. We have a machine that fogs the room every time someone goes out of the room. The entire room is fogged up with this antiviral solution. So we're following to the T all the CDC and the FDA guidelines for sterilization and for cleaning. So we're even doing more than we used to, but this has always been our practice. So what are some of the key concepts to prevent complication? Again, this is something that I need to know, but it's good to share with you because you don't think about this because it's not in your area of expertise, right? So, but it's nice for you to understand this because then you can ask your person that you're seeing about these things. So the first concept that's important to understand is not all complications are preventable. Most of them are, but some are not, or they're not. You can't avoid all of them, no matter how careful you are. For example, I have had patients over the years who finished the procedure, everything was great, they left the office and went to get into their car and bumped their head on the car door or the roof of the car and dislodged a few grafts. Well, came right back up and we replaced them, we reinserted them into the holes, into the sites. During the night, sometimes they'll reach up there and itch without knowing, and it's going to dislodge some grafts. Again, come to the office, we'll put them back in. So not a big deal as far as anything that's going to detriment the results, but these things, we know they can happen, so I can tell you, look, be careful, when you go in and out of your car, when you walk around the house and cabinet doors, low-hanging things, be careful not to bump your head. So all these things we can warn you, but they can only be prevented so much, right? So that's the unknown factor as well. Concept number 2 is susceptibility. That means that it can happen to the best of us. No matter how experienced I am, no matter how many surgeries I've done, thousands of them, I can still have complications. So I need to be on the lookout every single time. I cannot be complacent because by the time I do, that's when they happen and you're going to be the one paying the price for that. So I have to be on my toes all the time regarding complications. Now, I'm going to draw a parallel here regarding that. One of my favorite sports is Formula 1, and this guy here, some of you may know, Ayrton Senna. He's a fellow Brazilian. I'm from Brazil as well. He died, unfortunately, in 1994 during a race. At that point, he was the top driver in the F1 circuit. He was a 3-time world champion. Nobody was driving better than him. He's arguably one of the best ever racing car drivers for Formula 1. So one day, in a race in Italy, he had an accident. We don't know still to this day if it was a mechanical failure of the car or a mistake that he made in a turn, and died. So again, the best of the best are subject to problems. And so was he looking for that? He knew the risks and he was doing the best he could, but there are some inherent risks with everything that we do, including surgery, and so we just have to be on our toes all the time. So the other concept that's important to understand is that there is training and there is limitations. What do I mean by that? So I've been doing, as I mentioned before, hair transplants exclusively for the last 22 years maybe. Before I was doing a lot of other procedures. Now, what do I mean by training and experience? So let's say tomorrow my hair transplant practice goes south and I say, well, maybe I'll start doing some lipo. I've done a lot in the past, so it's easy, right? I'll start doing them tomorrow and I'll hang up a shingle here and I'll start advertising liposuction, for example. I'm just picking a procedure. It could be anything else. And I don't understand my limitations on it. Well, I haven't done liposuction in years. I understand the principles behind it, but if I start doing liposuction, my patients will suffer because number one, I'm limited at this point on my knowledge and my experience and my dexterity on the techniques. So without any training on it, I'll put patients at risk. Best case scenario, they're not going to get as good a result as they could if I had experience, if I had the training. So what do I have to do? If I'm honest with myself, if I care about what I do, I will go to the training. If I need to do lipo, I'm going to go and follow people that I know that are great at lipo. I will learn from them first for however long it takes until I feel comfortable that I know how to do it well. I know how to assess a patient for lipo, indicate the procedure, not indicate the procedure, when not to do it. That's almost much more difficult than actually doing is knowing when not to do a procedure on someone, right? So I will have to go through that training. Only then I would feel confident that I could treat you with some kind of decent techniques. Same thing too. And conversely, a lot of doctors now are great on other things. They're great at liposuction. They're great at facelifts. They're great at orthopedic surgery, whatever. And they, for some reason, they think that they saw this machine for sale during one of the conferences, and the salesperson told them, "Yeah, just buy this. We'll send you the team to your office, and you can start doing hair transplants tomorrow. You don't have to do anything. You don't have to worry about it. We'll take care of everything for you. Just give us some patients. We'll even bring some patients to you because of our advertising." So a lot of doctors have fallen prey to that. And unfortunately, a lot of patients have been and are being harmed by that because the doctor is really not doing anything. He's delegating to these technicians that the companies will send them, or they're relying on a machine to make all the calculations and push buttons on whatever, and then expect the machine to do everything. Hair transplant surgery is not simple. It may look simple, but it's a very complex procedure. A lot of decisions are made in real time, in a real fast environment as far as angle and direction of hair. So you need someone with experience. And so we're seeing complications now that we shouldn't be seeing. So it goes both ways, right? If I went to do something else, I would have to go train if I'm honest with myself, and if I want your best outcome, if it's on my best interest and your best interest, I'll go have trained first. So the same thing should happen with hair transplants. If you want to offer hair transplant procedures and you're great at liposuction, for example, that's fine. Just go learn how to do it. If not, don't do it because you're going to invite problems and the patients will suffer. So another comparison with motorsports, right? So this is Valentino Rossi. If you know him, he's a 9-time world champion on MotoGP. The guy, I mean, he still races today, but his golden days are behind him. He's a little older compared to the other drivers now. But anyway, 9-time world champion, nothing to sneeze at. So if you look at his technique here, he was so good that he's called the doctor, right? He's so precise. If you see the way that he takes the turn here, his legs are tucked in, his elbows are close to his body, he's leaning into the corner and taking the apex of the corner in a very crouched out and small position because of the center of gravity of the bike. Now if you look at this in comparison, this is Stefan Everts. It's a 10-time world champion in motocross racing. If you look at this, you say, well, if this is the right way to turn a corner, then this guy doesn't know what they're doing. They're just different. They're just different environments, and then it requires different techniques. So if this is liposuction and this is hair transplant surgery, you can't, they're not transferable automatically, because if you put Stefan Evans in a MotoGP bike, and if you get Valentino Rossi and put him on a motocross bike, they're not going to be very good right away. They'll have to practice. The techniques are completely different. You see here, he's leaning away from the corner. His legs are extended. His elbows are extended too. So totally different position, totally different technique to achieve the same result. So lipo, hair transplants, vice versa. You can't just one day wake up and say, well, I'm going to be the greatest hair transplant surgeon in the world if I haven't done any cases yet, but I don't care about training because it looks so easy. Or I bought the machine and now I'm all set. That's when we have problems. And we're seeing them, and we're going to see here. So So let's start by talking about complications that can happen in the donor area of the scalp. That's the area where we harvest the hairs from for the transplants. I'm going to start with strip harvest, or FUT. So this is probably the worst complication you can have from a strip procedure. It's called tissue necrosis or dehiscence. Basically, if you take too much of an area too wide and you close it and there's a lot of tension in the skin, you can stretch the vascular supply or the blood supply, and the skin around the edges won't survive, so it'll create these kind of dead areas there, and eventually it'll heal, but it'll leave a bigger scar there. So that's completely preventable. You just have to be careful. This area, particularly here, we all know behind the ear, there's a little mastoid bone there where the skin is much tighter. There's not a lot of movement. So when I train doctors on strip procedures, I warn them about this risk. And so this doctor was just a little bit overzealous, took a little bit too much. Well, other complication that we see with strip procedures is a wider scar, right? Not everybody heals with a pencil line scar. Most people do, but some people don't. So in this case here, the patient had a scar that was about twice as wide as it should have been. And because he wanted to keep his hair short, then it was visible, so it's a complication. Infections can happen, bleeding can happen, what we call hematomas can happen, or blood collections. Those are very rare, but you can have a suture break and the incision can open back up. So these are really rare complications. But again, if it's an experienced surgeon, we'll know we'll know what to do right away, and we'll bring you back to the office and fix the problem. The problem is what you do with follicular unit excision or FUE procedures. You'll see here some complications that are pretty tough to treat. Now, this is the most common one by far. It's what we call the scarring, right? So one of the things that the main draw for people to have FUE procedures is because they can keep their hair shorter and without seeing the scars. Well, obviously, this patient can't do that, right? So it already defeated the purpose. He would have to keep his hair longer to cover those scars. Probably not a big deal, but that's not why he did the FUE in the first place, probably. So what causes this? Skin of the patient can cause this. Some patients are at more risk for this, and again, knowledge and experience will make you a better selector of patients. So if you come to me and if you have a scalp that's more prone for this, I will address that with you and we can probably avoid it. Also, punches of large diameter or too close together. So these dots here, you can see they're much larger than the hair follicles. I can't zoom it, but anyway, so they're much larger than the follicular unit. So this the punch that was here is very, very large, and it creates more scarring, obviously. So you want to limit the diameter of your punch too. This can happen. It's not the end of the world because you can cover with some hair growth in there, but again, it's already limited. Well, how many more hairs can you take from this area? You can't do that anymore because otherwise it'll be bald spot, right? This, unfortunately, is what we're seeing more often now coming out from these what we call clandestine clinics or clandestine clinics. These are clinics that are being opened by non-physicians or technicians that do the procedure, or physicians with no training, and they do barbaric surgeries like this. This is an FUE. This should never look like this. I know it's very graphic, but it's important to know. Look at the size of the incisions. Look how close together these are. Horrible. This patient will never heal well. And even up here, it's just a mess. It's bloody and it's just not going to grow very well. So we're seeing results like this too. What happened here? Too many grafts taken from that area, very high in the donor, and then it caused all this thinning there. This patient, looking at him now, not even a good candidate for FUE to begin with because his hair was already thin to begin with. The angle of the hair was really high against the scalp. It wasn't an angle that permitted FUEs to be done. And so this was already a wrong indication to begin with. So again, perhaps inexperienced, perhaps overzealous, but just not understanding the mathematics of the hair. You can only take so many hairs before you start creating trauma. And unfortunately, not everybody takes that into account because they don't know, right? Worst cases of the same problem. Over-harvesting, so taking too many hairs from a small area, incisions too close together, lots of scarring, and you see here, lots of gaps, right? No hair there. very thin spot here. Now this patient has to keep his hair really long to cover that area. You can never harvest any more hairs there. And worse, what are you going to do about it? You can't treat it because, I mean, yeah, you can pick up the hairs that were placed there and kind of put them back in there, but I mean, that should never be a solution, right? Because that's what we're trying to avoid. You're going to undo the procedure that you did in the first place. And the other solution will be maybe hyperpigmentation or the tattooing, micro tattooing. You can get hairs, say, from the chest, for example, and then fill these areas. But none of these are ideal. The ideal thing is to prevent this, and these are preventable surgeries, complications. Recipient area, we're seeing a little bit here too. In this patient, no one in their right mind nowadays will do a procedure like this and consider it adequate, right? And this is not that old. Now, as you can see here, these are punches. These are grafts, I mean, pieces of skin that were removed with punches. That's like 30-year-old technique. Not even when I started doing this, we were doing this anymore. And then the hairs were placed there. Look at the space in between them. And first of all, this patient probably didn't even need a hair transplant. Look at his hairline is really nice. The hairline was completely misplaced, totally unnatural. But can you do something about this? Yeah, you can go in there and you can actually remove these hairs with an FUE, and you're gonna move them to the back somewhere, and it's gonna create some scarring in there, but it's gonna be better than having a hairline like this, because that is horrible, right? Other thing is you can laser the hairs and get rid of them. So there are some options here that are good, that are adequate, but again, I mean, who does this, right? It's just somebody that has no concept of anything. Now, this is a complication that we all have from time to time, and no matter how careful you are, it's called poor growth, right? So hair grafts, again, go to the video on hair grafts. I explain a little bit of that, and the link is up here for you. Once you remove the hairs from the scalp, it's deprived of blood flow and energy sources, so the hairs are slowly dying at that point. And so you only have so much time to put it back in the scalp and have it grow, because then you're going to start reconnecting to the blood flow and getting nutrition and all that. During the time between harvest and implantation, they should be at least preserved in a special solution, in a cold temperature, so there's a whole science behind it. If you don't do that, then you risk poor growth. And it happens to all of us. I mean, it's happened to me before too, and it's not a rare complication. It's probably the most common on the recipient zone. So these two patients, for example, had poor growth. And when I look at poor growth, I kind of wrote an article years ago about this classification of poor growth, because they can have different causes. So I divided into generalized poor growth, like here, where everywhere is sort of evenly poor, evenly thin. Or localized poor growth, where maybe this patient would have had everything growing nice, but there will be a spot that didn't grow well. The causes for these things are different, and you have to understand what they are. Not always preventable. Sometimes there's blood flow issues with the scalp. You don't know until you're there. And so, but it can be treated. I mean, of course, you're going to have to put more hair there, which you're going to use a little bit more donor hair. But fortunately for this patient here, in this case, the hairline is not that bad. There are some angles here in direction that are probably not ideal, but if this had all grown in, it would actually look decent because the hairline is not that bad. This other patient here has I have a problem with this angle here. So being a male, this is too far forward, and we should be a little bit more receded here. So you could remove some of these grafts, put it back in. Again, not ideal, but there's things we can do, and so not ideal situation, but there are solutions for it if you know someone with experience. You don't want to make something worse. All these complications, or some of these pictures, I actually got from the International Society of Hair Restoration Surgery's website, the ISHRS. I'm a part of the program. Many other surgeons across the world actually are part of this Fight the Fight program, which is an awareness campaign to the consumer, trying to educate you on the dangers of these clinics that are popping up everywhere now, offering really inexpensive hair transplant procedures done with FUE, very poor technique, very bad complications like we saw here. And so these complications are showing up more and more and more, and they shouldn't. So this is done for your benefit, so you can be alert. If you are going for an FUE procedure, if you decide that you're going to go for FUE, you have to be even more careful who you let work on your scalp, because the burden of success for FUE procedures is much higher. The problem with complications is much worse. So you want to go with someone that has a lot of experience, a lot of credentials, and you want to have a doctor doing it for you, okay? And a doctor seeing you for the consultation to recommend that. Then you can be safe. So check credentials in hair. Don't check credentials in anything else, because that doesn't matter, right? We saw before, training specifically for hair restoration surgery is a must. Like it would be a must for me for any other procedures that I wanted to do, okay? So don't forget that. Now, treatment options, I'm gonna go with this real quick just to show you. Again, that tissue necrosis, big scar, some hair loss here. What I did, this is a patient that a colleague of mine that I respect a lot, he trained me, he's a very good surgeon. Again, it happens to anybody, right? It can happen to everybody. So I had this procedure here with this scarring. The patient lives in Florida. This doctor friend of mine, his practices in the west coast of the US. So he asked me to see the patient. So what I did is I took a cross area here in the scar. It's called a quadruple advancement flap, basically. So I took out the scar and I sort of brought it together. So if you look closely, I don't know how well the camera can show, but there's a line of stitches in this way and one line this way. So hairs are much closer together, much easier to cover. We ended up having some grafts placed in these little areas about a year later, and the patient's very happy. So there's things we can do. Not the end of the world, right? This patient here is one of my patients, the wider scar that we saw before. I went ahead and took the scar out, removed it surgically, sutured back together with a few layers of sutures, and then it turned out much thinner. The patient was happy. Easy treatment. For growth, the treatment for this is to put more grafts, right? And then try to avoid what happened the first time. So when I have poor growth in the first procedure, I will make some changes to the second procedure in the medications that I use and everything, so I don't incur the same problem. This patient here, it's a poor placement, poor technique altogether, bad scarring, bad technique. I mean, I can't go on and on this, how wrong it is. So the treatment for this will be harvest the hairs one by one with the FUE punch, move them somewhere else, or go for laser hair removal, and there's going to be some scarring there, so lasering can be done, the skin, micro needling, all sorts of things for scars. It's a process, so not going to be easy, but it can be done. The main problem, again, just to put this image in your head, no pun intended, actually pun intended, is these complications. That is very tough because there's nothing you can do there. So again, if you're going for an FUE, if you're considering an FUE procedure, consider who you're doing it with. Make sure that the doctor has experience, has knowledge, and it abides by this formula here. Again, has knowledge, has experience, because then he or she will tell you if they don't think you're a good candidate for the surgery. That's patient selection. And if you are a good candidate, they will prevent complications to the best of their ability. So that's to keep in mind there. That's what I had for today. I know it's a long video. Thanks for sticking around with us. Hopefully this was helpful. Not a fun subject, but very important. Please like the channel if you enjoyed it. Subscribe so we can keep posting videos for you. Send us your comments. Send us your recommendations for other videos. We want to educate you on this procedure, on hair loss. It's our passion, and when it goes right, it's amazing. When it goes wrong, it can be amazing too, as long as you are a team with your doctor and they know what to do. But sometimes it can be a little bit difficult. So the best thing is to do your homework before you sign the dotted line. You know, if I can be of any help, you can call me. We'll do a free consultation, and I can help you through it too. That was it. Take care. Have a good one. I'll see you next time. Bye.